Every year, Harris County Public Health, which is the county's health department, publishes a report detailing the impact the department has had on its residents. Last month, the 2024 report was released. It highlights several stats about public health in our county. This report has a lot of data on how Harris County is doing from almost every aspect of how the county looks from a health and environmental perspective. With us now to tell us more about the report, we welcome Leah Barton, the Interim Executive Director of Harris County Public Health. Leah, good morning and welcome to Hello Houston.
Good morning. Thank you for having me.
So last year, or I guess in 2023, Harris County Public Health published its 5-year plan, which outlined your goals and objectives and your program initiatives. And there were 3 broad categories: improve community health, remove health disparities, and achieve optimal health for all. Here we are. Now you have a full year to look at and measure. How has the plan progressed and how do we look in 2024?
Yeah, we are absolutely making progress against those goals. One that I'll highlight, you mentioned reducing health disparities. Yeah. One that we're very focused on right now is maternal and child health. And we know that unfortunately in Harris County, we have rates of maternal mortality, infant mortality that are higher than in the rest of Texas and indeed in the rest of the nation.
Why is that?
Yeah.
So there's a wide range of causes. There's comorbidities like diabetes that can contribute. So the healthier a population is, the healthier their moms and babies will be. But at the same time, we also know that there's big racial disparities there, and black moms and babies, black moms are dying at 3 times the rate of those of other races.
But
and so,
as Frank mentions, though, why us? There are other communities like us across the globe, across the nation. Why are we in such a bad place there when it comes to that?
Diversity, maybe?
Well, what we're really focused on is fixing it. We just had a maternal and child health conference last month, which is our 3rd annual one. We've added maternal and child health home visiting programs to really work on getting people access to prenatal care. We won a $5 million award from the federal government to implement the Healthy Start program that works with young children. And our WIC program serves about 50,000 participants a year. So we're really focused on trying to support expectant parents and babies across Harris County.
I know this is a challenging time for public health all across the country. I'm curious because, I'm that get vaxxed kind of guy here. What did we learn, do you think, from the COVID-19 situation we went through for a number of years? And how is that impacting vaccination programs and how you get the messages out now? What did you learn from that?
Yeah, I think with COVID, we learned just how important trust is. And I hope that Harris County Public Health emerged as a trusted voice during that time. But we also realized that being really open with people about risks, about benefits of vaccination is critical. And simply walking around with a vaccination message without that supporting rationale is really important. And so part of what we have seen post-COVID is we've seen vaccination rates come down a little bit. There were kids who didn't make it to the doctor for their well-child visits, and now we are seeing some of the impacts of that in our community.
Did the report look at how trusted Harris County Public Health became? Did it do anything to judge how much we depend or trust the messaging out of there? Because we can see nationwide there's a lot of lack of trust in public health. But was Harris County different? Was that one of the things you looked at?
So our annual report really focuses on the activities within the department of our 14 offices and divisions and what they've been able to accomplish.
So I got my monkeypox vaccine from Harris County.
Great.
I did too.
Yes.
And
thank you.
Remember there was this sort of, I don't know if it was true or a rumor, that you could be standing next to someone and your elbow could touch their elbow and you could get monkeypox. There was this really explosive information going on. So and they were great. They were just great. So is monkeypox even still around? Is that even still a thing?
It is still around. We are actively vaccinating people against monkeypox, and that was a time when building trust was so important, and we had folks going out to the clubs at 2 a.m. and putting shots in arms. So, we still see a few cases coming through, and fortunately not as many as in that moment, but still important.
Just point of clarity, now it's called Mpox.
Yes.
We didn't want to disparage those poor monkeys, so it's just Mpox now.
Thank you. So, what are the big vaccines recommended these days?
Well, I mean, the CDC has, a recommended vaccine
list.
schedule. Yeah.
But what I found interesting about this report is that Harris County Public Health doesn't just release one annual report. You published 8. And within those 8, walk us through why you felt the need to highlight these 8 different reports.
Yeah. So we have a fantastic epidemiology team that analyzes health data, and some of the reports that they released last year focused on specific aspects of health. Chronic disease was a report. Rates of HIV and STIs in Harris County.
Which are on the rise.
They are.
Yes.
Thank you for reading it.
Yes. I did. The report is 60 pages, so just so you know. I did
they were really on the rise in the Black community for a long time. Is that still the case?
We still see higher rates, yeah. And we published a report on extreme heat, particularly given the storms that we saw last year, the power outages, impacts of extreme heat are very much with us. Report on maternal health, on impacts of air pollution. So kind of a wide range of topics in terms of not only what is impacting our residents, but what are we doing about it, and what would we like partners to do about it.
To piggyback on that, equity runs through the whole report. What I want to know is what areas you saw that were persistent inequalities in 2024. So then what for 2025 are you planning to do to help bridge that gap?
Yeah. So I already mentioned the maternal mortality, infant morbidity rates. We also see disparities in cancer. So within that chronic disease report, one of the things that jumps out is very high rates of prostate cancer in Black men. So within all of that chronic disease work, we really want to emphasize early screening and early detection so that people can get good care as soon as possible.
How are you targeting these communities? What's going to be the plan going forward?
So we do extensive mapping to see just what's needed where, and then we have a great Office of Communications, Education, and Engagement that will go out not only with digital campaigns, but on the ground campaigns. We're always at community events. You'll see us around the community, trying to meet people where they are in whatever language they're speaking. So,
to that point, do you vaccinate undocumented people? I mean, is that common, and can anyone go in for a vaccination?
So we vaccinate people who are generally of low income, and we don't ask about citizenship status.
And so they shouldn't fear going to get a vaccine and ICE being there.
I can't speak for ICE, but we certainly encourage everybody to get vaccinated. That's important for individuals and the community.
So one of the categories that falls under Harris County Public Health is the Environmental Public Health Division, which this is where all the food inspections are done for restaurants. Leah, we like to consider ourselves a foodie city, and we're very much into the food scene here in Houston. The EPH performed 19,713 food inspections last year. Give me some good news. How did we do?
We actually have a very robust food safety infrastructure. You can
That's
go eat at a
to
restaurant, and it's not only restaurants. It's food trucks, it's nursing home cafeterias, it's anywhere fresh food is sold. If there's ice cream in your convenience store, a food inspector has been there to check it out.
Great.
I want to inspect ice cream.
Yeah, right. How's the mosquito control? I got eaten up this weekend.
Mosquitoes is another thing in your report.
Yes. So mosquito control is one of the services that we offer for all of Harris County. And we do that first by trapping and testing mosquitoes. And then wherever we see mosquito-borne disease, which here is principally West Nile virus, we'll go spray. And so this is not nuisance spraying, sorry. This is really spraying for the purpose of disease prevention.
So, Leah, right now there's clearly a lot of questions around funding. And the fiscal year of 2024, your annual operating budget for the Harris County Public Health was $228 million. 57% of that comes from grant funds. How are we looking as we look into the next couple of years moving forward?
Yeah. So we have one set of funding that we knew was going to roll off, right? So you mentioned COVID earlier. We got quite a lot of COVID recovery funds, and Harris County Commissioners Court was very forward thinking and invested that in health and housing and jobs and education and justice and safety. However, many of those funds have a 2026 end date. Of course, we also have other federal funds, and you're watching the news. You are the news, and so federal funding is challenged. So we're watching that very closely.
What do you want people of Harris County to understand when they might be worried about that funding?
I can't reassure them that it won't go away, but what I can reassure them is that Harris County Public Health will be here, protecting health and preventing disease and injury and promoting well-being at whatever level is available to us through our funding.
Last question for me. What should be on our radar that we should come to you guys for? What vaccines do you think right now are most important that people get? What's the best we can do individually to help support our health in this community right now?
Yeah. Of course, we're looking at measles, right? We have a very large measles outbreak in West Texas, and we're lucky that in Harris County we have a pretty good measles vaccination rate, but it can always be better. And because measles is so contagious, it's kind of the canary in the coal mine. And so that's indicating that we may have some cracks in our vaccination rates, and we really want to make sure that people are trusting their pediatrician, getting the right advice, and moving forward with that CDC schedule.
Leah Barton is the Interim Executive Director for Harris County Public Health. Leah, thank you so much for joining us today on Hello Houston.
Thank you for having me.